This week, First Lady Karen Pence launched Labor of Love, a joint campaign with the Indiana State Department of Health to provide education on infant mortality. Research shows comprehensive prenatal care is one factor that helps fight infant deaths. We recently brought you a story about midwives providing maternity options for women at home. Now we see how these maternal health advocates are serving women at area health facilities.
Luz, ¿dónde están las luces?
Elizabeth Ray was born at home last year, literally.
I think it's going to be pretty amazing that she knows that she was born at home, and it was such a neat experience.
Elizabeth's mother, 35-year-old Joanna Perez Ray, says when she moved to Carmel, Indiana a few years ago from Chile, she wanted to embrace a form of birth culturally frowned upon. She used a certified professional midwife, a care provider who is legally licensed but not medically.
I think the doctor was very I don't know. I don't want to read into her reaction, but she looked at us as parents as if we didn't know what we were doing, you know. It's like, oh, home birth.
We are made to be with women, which is what midwifery means, with the wife.
Mary Ellis is a hospital-based midwife, often called a certified nurse midwife. A certified nurse midwife can provide primary care for moms-to-be. She says home births are less frequent in the state and thinks a hospital setting is safest.
Things right down the hall, within steps, is to me really important. And then also access to these wonderful physicians that we have. If there is a problem, a slight problem, test results. We have the access to highly skilled physicians. Say, hey doc, what's going on here? What should our course be?
Both professional and nurse midwives are still used in the state, with a majority practicing in hospitals. The latest 2012 Indiana natality report shows fewer than 6,000 Indiana births were attended by some type of midwife. Indiana Deputy State Health Commissioner Jennifer Walthall says the state advises women to opt for hospital births. That's where they can access care from obstetricians and from midwives who've earned medical certification.
We endorse national guidelines that in-hospital births are the safest for babies. Home births, although a viable option for many, do not undergo the same type of regulation and licensure as those that occur in the hospital, where quality metrics that we endorse are applied.
Dígale hola. Hola.
Perez Ray says that environment is not for her.
I wasn't against the idea of having a hospital birth. It's just like I didn't like it. You have the doctor, you have the assistant, you have the blah, 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 blah. Like, I don't know, like 10 people come and look at you and, open your legs, let me see. It's like, I wanted to have peace, and I thought being in my home, just going through the whole process in my home, I mean, what can be better than that?
This week, First Lady Karen Pence and the Health Department launched the $1 million public health campaign, Labor of Love, to promote education for pregnant women and new parents. It's created to combat a dismal statistic. An Indiana baby dies every 13 hours. A growing body of health policy experts say midwifery care, which often includes comprehensive prenatal care in addition to delivery, can be life-saving. A June 2014 report from the World Health Organization and its health partners calls midwives essential and reports their services could cut maternal and newborn deaths by 2/3 worldwide if properly trained.
If we can get her to be the healthiest she can pre-pregnancy, that would be great. And then keep up with it.
Midwives like Ellis think midwifery provides vital prenatal care, especially for low-income women.
And we are called to work with the poorer women. That's just how we are. To grow a society, we need our birth rate to keep going and keep going up.
North Shore provides their services with sliding scale fees. Lake County has a higher below poverty rate than the state, with nearly 1 in 5 people living in poverty.
Where can we do the most good? They go and speak to our counselors about presumptive Medicaid. And if you are here and you live here and this was your home birth home, then you're eligible for this. Basic service, but still service.
And says though birth setting should be a choice, prenatal care is a definite priority.
I think that if you have the option to have a home birth, it's It's very, very empowering for women because in a way, you're not forced to do something that you just feel inside that you shouldn't. You know, but if you choose a hospital birth, it's your choice.
I love that part. A family is made right before your very eyes. There were 4 people in this room and now there's 5. It's pretty darn cool. It's just, it's like working around miracles every day. It's really cool.